हे जेन्ना आमी एडवोकेट करता तेन्ना खंय तरी थोडेशे त्याचे सायड इफेक्ट एक पॉसिबिलिटी येवंक शकता. सो व्हॉट आर दोज पॉसिबिलिटी?
We will discuss, sir, samko baro question. As you said correctly, side effects samke important asa ani kire zala ni. There's a lot of misinformation about
Correct.
side effects among the general population. So I think this is a very good forum for us to address it. We will first begin by addressing the side effects of the implant. The commonest side effect of the implant are menstrual disturbances. Menstrual disturbances म्हणल्यार मदी मदी period, मदी मदी spotting जावप. केन्ना केन्ना थोड्या बायलांक ते सामके periods burn जावंक शकता. Now what we need to know, these menstrual disturbances are harmless. They are happening because body आम्ही एक नवीन hormone introduce केला. So that hormone takes a little time to adjust into the body आणि त्याचे levels fluctuate जाता म्हणून there will be slight amount of irregular spotting, irregular bleeding. So these side effects commonly begin immediately after use and by about 6 to 7 months they samke burn jata. So these are disturbing for you in your daily life, but mentally and clinically and medically nothing to be worried about. Second common side effects that could include for this particular implant may be a little discomfort in your arm as soon as you insert it. But they first 5 days are kuch last karta. Tachenantar the discomfort is almost gone. Okay. Other the common things because of progesterone, women could experience a little mild breast discomfort. They first 3 months are good. Tachenantar as your body adjusts to the hormones, it goes away. Now coming on to the IUCD is a very important topic because खूपशे लोकांक आता इतले मिसकन्सेप्शन झाल्या की हां कॉपर्टी घातल्यानंतर ती म्हजे पोटान पावली कोणा कोणाक दिसता ती म्हजी तकलेर पावला and once an IUCD is put, a lot of women feel की एकदा कॉपर्टी घातले की ना whatever problems happen after that is because of the copperty. So common complaints with the copperty is heavy bleeding आणि ती heavy bleeding हुई first 6 to 7 months कुछ जाता. You can meet a gynecologist usually with a little medications ती settle जाता and like I said because a new device has been introduced into your body you tend to have that little initial adjustment issues. आमका सगळ्यांक जाता नी if you have something new to do, if you have something new to embark on, so that adjustment issues असतात. Similarly, your body is being put through a new process, so there will be a few adjustment issues. As the time progresses, the copperty, the benefit, the bleeding reduces, and slowly everything else settles. The second common reason, complications that could be common for both the implant and the copperty is if the technique of insertion is not proper. So, आम्ही sterile techniques use करून घालूंक ना तर then there could be infection. But in today's day and age, we are so particular about safe practices that the chances of an infection occurring because of the hospital or because of insertion is very, very rare. Please note, it's not there, it is just very, very rare. So, ये common side effects.